Welcome back to the podcast. I'm Dr. Christopher Nolikin.
And I'm Dr. Lindsay Renzullo. We're happy to have you guys today.
So today we wanted to open up with just a big shout out to our veterinary technicians. This week is Veterinary Technician Appreciation Week.
Appreciation Week. Yep. It's the whole week in October. It's dedicated to them. And vet techs are really what drive our hospital. You know, all of the things that we do every single day would not be possible without our veterinary technicians. And at Bulger, we actually make it sort of an employee appreciation, which is really nice because not only are vet techs super important to our hospitals, but also the client care and kennel assistants and everybody that sort of helps make that hospital function. So we have a fun week for all of our employees at Bulger in particular.
Yeah. So, I mean, we always, honestly, like when you come into the vet, a lot of the time the doctors get all the credit for everything, but pretty much everything that we do is 100%, 150%. We could not do it without the technicians. The technicians are the ones who are often retrieving pets from the cars or bringing you into the hospital in a non-COVID world. They are doing the pet restraint to make sure that we don't get bitten. They are drawing blood. They are often doing, writing up those discharge instructions for you and giving you all the answers to all of the questions that you might be asking them. Like they just do so much. And then, our receptionists, our client care coordinators is what we call them. Again, answer all those questions, book those appointments, answer those phone calls. There's just no way that we could be functioning without them.
No. And I mean, with the vet techs in general, they function with everything that Chris had sort of mentioned before, but they are our right-hand man when it comes to surgery and, even just all of their expertise. Some techs that have been, working in a veterinary hospital for years and years have seen so many things that some of the newer doctors haven't even seen before. And so their expertise is something that's invaluable. There's a few techs that work that all the techs I adore, but few technicians there that really have seen so much and they add so much to the medical care to the pets. So we truly appreciate all that they do. I feel like a week is definitely deserved for all that they do in our hospital.
Yeah. So next time you're at the hospital, definitely show some love to the techs and thank them just like you would the doctors. And we just love you all.
Yeah, we do. We love you guys.
So this week, this month's episode, we are doing another Ask the Vet segment. So this is just kind of a conglomeration of various different frequently asked questions that we've come across on our social media or things that are coming through the hospital with questions from clients. So I'll start out with one that we've been getting a lot of questions when we've had, gaps where the appointment availability isn't as good as we want it to be. So then we'll get clients calling in with these like panicked questions about things. And so, one of those was, my dog is due for booster vaccinations. They got vaccines about a month ago and I was supposed to come in for these, but now I called and we don't have an appointment for a week. So is that okay? Because I was told I had to get them at 4 weeks. So Lindsay, do you want to field that question?
Sure, I sure will. Yeah. And I mean, it is something that's important. So vaccines do need to be on a schedule. So you are right to sort of feel as though you need to get it done in a certain time frame. And there is a time frame, but the thing that's great about it is that the time frame is flexible. So they do not need to be exactly at that 2 week or 4 week mark. They really can be anywhere from like 2 up to like 6 weeks in between booster vaccines. So there's this huge area that you can kind of have. You have a little bit of time buffering where you don't have to worry about missing that exact appointment and making it only a few days later or a week later even. Often these vaccines are okay. If there's a significant gap in between vaccinations, so like let's say you get your puppy gets the first 2 vaccines, first 2 boosters, and then you kind of just forget and you don't come back and it's been maybe like 6 months or so. At that point, what we would do is we would just restart a series, but it's much faster this time. Instead of your initial puppy or kitten visit, where typically is a 3 visit type of thing, it would just be a vaccine and then, 2 to 6 weeks later, get that booster. And then that way that vaccine is official and good. And it's just the way that the immune response is triggered in each animal. So you need that booster vaccine to trigger that own innate immunity in that animal to give a protective response if they're ever exposed to something. So the boosters are something that are needed. For most vaccines. Some vaccines you don't need to have a booster at all. So things like the kennel cough vaccine is typically one vaccine we just sort of give. The rabies vaccine is a big one. That's a vaccine that you just give and you don't need it in a booster, initial booster. So yes, even though you are correct in getting worried about a time frame that you need to be for, your pet to get into the hospital, you don't have to worry about it being a little bit varied as far as, a few days or a week or so. A lot of times that is okay.
Yeah, and I always have people, because appointment availability is so tough right now. Again, we don't know why it's so crazy in the veterinary field, but we're very booked a lot of the time. So, when you're in for your puppy visits, get them on the schedule, even get all of them on the schedule. But if something should happen, you have to reschedule. It isn't the end of the world. That 6 weeks is very much, we just follow the guidelines set forth by organizations that have studied this. There's not a lot of research that goes into the exact time frame when it is absolutely too late. That's based upon a lot of knowledge of vaccinations in general. And so 6 weeks is the maximum. We definitely don't want you to just try to go 6 weeks. We want you to try for the ideal time frame, which is usually 2 to 4 weeks in between vaccinations. But if on the one-off situation you have to, that's kind of where it is. So a day late, if you were scheduled for 4 weeks and now you have to be 4 weeks and 1 day, totally fine, right?
Yes, totally fine.
Totally fine.
And on that late feeling, people getting worried about things that are late, often we get calls about, oh my gosh, I, missed my pet's heartworm medication, or I ordered it and it's not going to come in for another week or two. What do I do now? Can I give it in the pill? Can I not give him the pill? Is this going to be bad? What's going to happen? So do you want to field that question?
Sure. Yeah. So being late on your heartworm pill is fine to a point, right? So the way that these heartworm pills work is that you're giving them and it is actually going backwards and it is killing all of the larvae that your pet might have been exposed to over the last month or more. So there's not a firm at 1 month exactly, it cuts off completely. So a day late, a day early makes absolutely no difference at all. We think that effect goes back maybe 2 months. But the reason that we always say give it every month, once a month on the dot is, again, so you don't forget. And so that if you did miss even a whole pill, just it happens, you're not in this dire straits. But if you should miss a pill and it was only every 2 months or every 3 months, that would be risking your pet. So give it once a month. But if you're a couple of days late, even a week late, totally fine. Just give it and move on. The next month, do it the date you were going to give it anyway. Stick with your schedule so that you don't get completely thrown off. But that little bit of slush is there for good purpose.
Yeah. And it really does have a good safety margin, so if you are, like, Krista said, if you do forget it and you give it, a week late, and then you want to always give it on the first of the month because that's your day, it's okay to give it again the first of the month, even though it's only been 3 weeks. There's a really good safety margin for these medications. So it is okay to get back on track.
And then we're not going to test because you missed a pill. Like, say you missed an entire pill.
That's a good point. Yeah.
You do not need to immediately bring your pet in for a test. And there's, again, good science and good reason behind that, because we cannot detect it that early. We can only detect it greater than 6 to 7 months after the missed pill. So because of that length of time, we're just going to do our annual heartworm testing as we always would whenever that was going to be due. And we're not going to worry about that one that you missed. We're just going to catch it if it's positive because we do it every year. So.
Yeah. And that's a good point. Actually, I actually had a puppy owner recently ask me, because they had dogs before. And they said at the last puppy visit, they said, shouldn't you be doing the heartworm test as well? And it was only a 4-month-old puppy at that point. And I said, that's a great question. I'm glad that you asked. No, we'll do it at the next visit when the dog is older for the yearly annual exam, because at 4 months old, we really can't even detect it. Even if theoretically your dog was exposed to heartworm at 8 weeks of age and you weren't treating, you have a totally susceptible dog, you wouldn't be able to pick that up at that 4-month mark. So it's a great point to note.
So we don't want to do unnecessary testing. You could do heartworm test every month if you wanted to, but there's just no purpose. And so that's just a waste of your your money and your dog's blood.
Yeah. Yeah.
Right.
Yeah, I mean, but heartworm tests do have a lot. We say heartworm tests; they do have other organisms that they will pick up too as well. So they often pick up those heartworm tests, pick up things like Lyme disease or Anaplasma or Ehrlichia. So other common tick-borne diseases are picked up on those tests too. So sometimes we will do a tick-borne test on a younger animal if need be, if they're showing signs of it, if they're really sick with a fever or things like that. But it's not that common that we do that. Yeah.
Lauren, do you have any other frequent questions that you wanted us to ask, or do you want us to go through our recommendations for animals, things that they should receive?
I do have a couple questions lined up. And these are popular questions that people have been asking. And one of these I find very interesting. It's, have you heard of PrettyLitter? And do you think it's helpful in picking up health problems in cats?
Ooh,
I have heard of PrettyLitter. Have you, Lindsay?
I actually have not heard of PrettyLitter.
Yeah, so I looked into it actually for my own pets. It's pretty expensive overall.
PrettyLitter.
Yeah, so it's like a tray, and I don't remember every single detail about it, but it is like these little trays that you get that are like a crystal-based litter. I don't know for sure if they're clumping or not, but they detect mainly they detect inflammation. So they're supposed to detect, I believe it's white blood cells or something that would be indicative of like a lower urinary tract disease in cats. Um, I, when I looked at it, my first thought was, that's not something that I want to detect the same way. Like, I think there are valuable types of detection in cat litter. Like, if I could have a cat litter, there previously was one that detected glucose, right?
Yeah.
So that would be really useful in a diabetic cat, or somewhat useful in a diabetic cat. I did not necessarily feel like the things that they were looking for in the PrettyLitter were that clinically relevant to me. So it's like great that they can test for these things, but I didn't necessarily, I don't know, I didn't find what they were testing for as useful as other things would be.
Interesting.
But it's like a subscription-based litter that you get, and it's, I'm looking it up now. It's supposed to be like less stinky and less dusty, which are always great because all cat litters, no matter whether they say they're 99.9% dust free, they are definitely all still dusty, and my office can prove that.
Yeah. I mean, that's a good point too to sort of bring up though, if we're talking about like litter changes in kitties, because I mean, sometimes, owners think that changing the litter either to a certain type of substrate is better for the cat, or, frequently changing it to kind of mix it up. Some owners think that, let me try this now. Let me try this one next. Let me try this one next. Oh, this one's on sale. I'll buy this one now. Just be cognizant of the fact that cats are very finicky little creatures, and that frequent changes to their litter or to the type of litter box that you have can sometimes stress these kitties out, even though you wouldn't think it would stress them out. So I've had owners that have had cats that have developed, cases of what's called like idiopathic cystitis. It basically makes them feel like they have a UTI, that they need to pee very often and urinate very frequently. And their bladder has like lots of red blood cells and stuff and irritation in there and inflammation. But it's mostly like a stress trigger thing that's causing this. And sometimes changing the litter frequently or changing the substrate often can do that. There's certain litters that are just a little bit more predisposed, or I guess prone to having cats have issues with them. But just watch it. I don't know anything about this PrettyLitter yet. I'm going to definitely look it up.
I looked it up. It tests for alkalinity, acidity, and blood. And so those are, generally they're talking about those as being indicators, ironically, for the stress associated thing that you mentioned. So it's, what you would hate is to switch the cat litter on a cat and stress the cat out. And thus now you're picking up an issue that you wouldn't have had you not changed the litter. I don't think there's any major problem with looking for those things. There are certainly cats that do have frequent episodes of urinary issues that you might be able to detect there. But I will say you will also detect those things just based upon the cat's behavior. So,
yeah,
the biggest problem that I would have is always the sort of the opposite problem, that your cat litter's picking up something, and then that prompts you to go to the vet for it, and then I can't find a problem or figure out what to do. And so it can be hard, I think, for vets to kind of navigate that. Like, well, but I did a urinalysis and it's not showing these things, but yes, it's showing that, but the cat is clinically fine. So I think it's fine to make switches to those kinds of early indicator products as long as you're realistic about sometimes they're detecting nothing and showing you something.
Yeah, it's a good point. I feel like anytime you do a test, you're doing a test for a reason to give you, information to change something or do some sort of actionable item. And if you have a cat litter that you just like want to see if your cat has alkaline urine, what are you going to do with that information if your cat clinically is doing A-okay at home? It's a good point.
Yeah. So I have a couple others. If you know something is very off with your pet, but they aren't showing outward signs, what can you do?
I guess
they mean more like the ADR kind of thing.
Yeah. So ADR is means ain't doing right. So that's veterinary lingo for, the owner's not really sure what specifically, but they just feel like the animal's not well. I mean, I feel like those are good times to, bring the pet in and just have them have once over but be open to that. We as vets aren't going to always be able to tell everything from an exam, right? So if your pet is generally seeding off and you can't describe it, we deal with that all the time, right, Lindsay? Like, how often do people come in and they're just like, I can't put my finger on it, but they're just not right.
And sometimes people are like spot on. Sometimes they bring them in and they said something's off. And then when you do a really good physical exam or you start doing diagnostics, you start doing blood work and things like that, you start realizing, okay, maybe this pet is really anemic. That's bizarre, or the pet has lost some weight. So there could be something to it. But yeah, the ADR, the ain't doing right, those ones are the ones that those kind of cases, make us need to do the diagnostics that we have at hand to start giving us answers, start putting that piece of that puzzle together. So sometimes those are hard. Those are the ones where we need a little bit of understanding from the owner's part that maybe we can't on physical alone be able to tell what might be going on. And so doing diagnostics gives us a good indication about what might be going on, systemically with this pet, if there's anything abnormal that's sort of picked up, to try to help figure out what is going on. And sometimes they can have these weird episodes. I've had patients over the years where somebody thinks that something's wrong. We examine the pet's physical exam is totally normal. We end up doing blood work. Sometimes we even do an ultrasound and everything is normal. And then they're like, I think they're doing better. Like, I don't know what that was. Like, they're doing fine now. And so, I do think that pets, just like all of us, can sometimes have ups and downs. We kind of rely that they're a little bit more consistent. We sort of think that they should always be this like stable little creature, but sometimes they do have a little ups and downs and we might not always find out what was going on. But other times it can mean something serious, Yeah.
And there's whole categories of things that are either episodic, right? So like it happens, but it happened at home and we didn't get to see it, right? And also things that may be episodic or may be consistent, but that don't show up on blood work. So I always think of things like neurologic disease. Right? So you can have a brain tumor and there will be nothing showing up on blood work and maybe even nothing on exam. But, there are definitely diagnostic tests to reveal those things. It's just that sometimes you have to take the leap as an owner and say, okay, that said there's nothing on the blood work, there's nothing on the exam, but we're going to agree with you. Like, your assessment is right. And so do you want to take the step of going for, a different take on it or a second opinion or to a specialist that we're to, because we feel like it's in a certain body system that we can't detect.
Yeah, no, that's a good point. I mean, cardiac things can be like that too. If we have something going on where a pet is having an arrhythmia, or they're having these weird, syncopal episodes where they're fainting, or they're, having, people are thinking, is it a seizure? Is it a fainting? Sometimes those physical exams and those blood works are totally normal. So we rely a lot of times on what you're reporting at home. Videos are always awesome. If you can take a video or a snapshot, if they're doing something weird at home, that can always help us out too.
I'll tell you what the worst ones are though, like when someone comes in, and I don't mean by worst, like that you're being bad by doing this as an owner, but I just mean like the ones that put such a weight of responsibility on me is when somebody comes in and says, they're definitely not right. I just want you to look at them and reassure me. Right. But I don't
Yes,
want to do
yes.
any testing. And that's fine if you don't want to do any testing. But like, then I'm like, well, geez, I don't know. I mean, is he okay? Is he
Right.
not okay? Like just this one exam. Okay, let's do it, but I just can't tell everything on an examination.
Right.
On that note too, just anecdotally, I want to bring up that there is this Instagram account. I don't know if you've seen it, called What About Bunny?
No, I don't. I
Have you
don't
seen this?
actually. I'm old, and so I don't do Instagram.
As am I.
Okay. Well, What About Bunny is this dog. It's a dog account, and her mom runs the account, and she is training Bunny language skills. So she has those language buttons that you record, like sit, stay, all that stuff. And Bunny is now at a point where she has a soundboard of words. It's incredible. But I bring this up because one of her, it's like a doodle. I'll link it for the video so people can go check it out. But it's a type of doodle. And so I'm bringing this up because this week she posted a video where she went over to her soundboard and hit ouch. And then so her mom cues back and said, "What ouch, Bunny?" And Bunny then goes over to paw and then walks over to the owner and puts the paw up. And there was a stick in a mat stuck in the paw. Now, I do want to say this dog has been training for a long time. And you can imagine they started with just one button, and it was like outside. And so like they built onto it, and they're actually doing scientific studies, this mom and Bunny with a group. But anyway, it was just amazing to have words. The dog knew that something was wrong. I think she also used the word angry or mad. I think her button says mad. So it started with mad. And then the mom was like, well, what are you mad about? And then ouch.
Wow, that's crazy.
Oh, and I can't teach my dog to use a doorbell to go outside. So
I just thought it was really great, and it would be so nice if all dogs could just use their voice and tell us.
Yeah, that's crazy.
So I have another question. I'm actually going to skip to this one because I think it's somewhat relevant to what we were just talking about, and that's: do you recommend getting a second opinion whenever you get a big diagnosis?
Oh, that's a good question. I like that, Lauren. Yeah.
I don't know. I mean, so a big diagnosis for vets is often kind of a slam dunk. So it's a tricky one because I don't think that every situation where there's a big diagnosis is either worthy of that or you may not have time, right?
Yeah.
So, I definitely am not an advocate of you bring your dog into an ER hospital and they say your dog has bloat. Please do not take your pet elsewhere to get a second opinion because that will kill your pet.
Yeah.
So, right.
Yeah.
I don't know. What do you think, Lindsay?
I think it depends on the diagnosis, just like you said. So I think that you need to look at what the vet is saying and what diagnosis they're coming up with, and also their comfort level. So yes, there's certain things, emergent things, that you need to sort of rely on that emergency vet to give you that information to make a decision right then and there. So your dog has blood in its abdomen. It has a condition known as hemoabdomen. These are the potential causes. Here's what we can do. That's not a moment in time where you say, I'm going to take the dog home. I'm going to bring it to my vet in the morning and see if the vet in the morning thinks the same thing, where that dog would need emergency surgery that evening. So there are certain diagnoses that really, you don't have time to get that second opinion. You need to rely on it. But then there are other diagnoses where I don't think it's wrong. I think you have to look at your own comfort level. I always tell clients, do what you feel comfortable with. Anytime that I have a diagnosis of, if I take off a mass that's cancerous, or if I take, do an aspirate and there's cancer cells there, I'll tell the owners, very upfront, say, look, we're getting this, I took this mass off. This is the type of mass that it is. This is typically how these masses behave. This is what I would do. If you feel more comfortable, though, seeing a veterinary oncologist that deals with cancer all the time, then yes, go right ahead and see them. Or I might even say to them, based on this mass that I'm getting and based on the type of cancer it is, I'm not super comfortable treating this, or this would require chemotherapy. I need you to go to the oncologist and get that second opinion and talk about the treatment options that you have from there. And
I think
so
that's the key though, right, Lindsay, is I see a lot of cases that come in the general practice, right? They're coming
Right.
from another vet and they're bringing all of their stuff and saying, I want you to give me a second opinion. For me, a second opinion means I'm sending you to someone with more expertise than me.
Correct. Yeah.
Right?
Yes, no, that's a great distinction because, even though you can have, 100 general practice vets all together, and maybe at the end of the day, there might be some varying opinion on various things that you present your patient with. At the end of the day, it should be able to be where you go to your vet analyzes it. Either your pet has a neurologic problem, your pet has a cardiac problem, your pet has a cancer problem, and we will then take that and bring you to somebody else that has much more information in that field. And that's typically how I would approach it. Even with certain specialties, like, ophthalmology is one where, a lot of vets, I should say, just the level of confidence that they have in diagnosing certain conditions, they may not have it. And so it might be something that, if you have one general practice doctor take a look at it, they may feel comfortable diagnosing it. And then another one might not and say, you need to go to somebody else. And so you have to listen to each individual vet about their comfort level and what they're diagnosing, what they're finding, and have trust in your vet too.
Yeah. So if you have, hopefully you have a vet that you trust. And so let's start with that. If you don't have a vet that you trust, then you should find one that you trust, right?
Right.
Even if it's just about the way that you interact with them, if you're just not on the same wavelength, let's make sure that during health you trust your vet. And then when they come up with a bigger diagnosis, I think having the conversation, how confident are you about this? If your vet that you trust says, I am 100% confident that this is what's going on, then unless you need a second opinion because you need the specialty care, then I think that word is fine.
Yeah.
But they're very rarely going to say 100%, right, Lindsay? Like vets are not into being all, 100. If they say 100%, then I think you're pretty good. Now you still might want to seek out a specialist to kind of fine tune care. It really just depends on the condition.
Yeah. Yeah. That was a good question. I like that.
All right. Next one is, does my cat really need to go to the vet every year when they're indoor?
Woo!
And I feel like we've had this question a lot before, but it's a popular one.
It's a popular one. You said that October is a big month for cats, right? Because
it's National Cat Day at the end of October. I think the 29th.
Okay.
It's also, I don't know what day, but there's some sort of Black Cat Awareness Day because, there's data that says that Black cats are adopted less frequently.
Right.
Which is interesting. But yeah, so it's a cat month.
Yeah. Oh, those poor black cats too. I had a black cat.
I have a black cat.
I know.
She's pretty typical Halloween cat, but she has given me only good luck.
Yeah, they're like nice little mini panthers in your house. They're so cool. So your cat does need to go to the vet. Yes, it does. Even though it's an indoor only cat and you think that all they're going to do is hang out on the couch and, eat their little kitty food. It really is important to make sure that your indoor cat is getting regular checkups at your vet. There are so many different things that we can pick up on that physical exam. So, you talk about, pet owners. Earlier, we were talking about pet owners saying, well, something's not right with this pet. Often with kitties, they do such a good job at sort of hiding some stuff. They might not show you full out like the dogs might, that something's up and something's wrong with them, that we may pick up various things from like heart murmurs to really bad dental disease to, obesity. So we can pick up a lot of things on physical exam that we can do stuff about and address and make sure your cat is living a better, healthier life. So I think people always think that their dogs need the care more so than the cats, but the kitties really do need to come in to be seen.
Yeah, I just had so many. I mean, when we see cats annually, so for a point of reference, cats don't often come into the vet as much as their dog patients do. About only 15% of our cases are cats. And that more than 15% of the pet owning population owns cats, right? But when we see them every year, we examine them, even if it's not the same vet, but hopefully if it's the same vet year after year, we're weighing them. How much importance does the weight have, Lindsay? Like you see this cat that hasn't been to the vet ever,
right?
And comes in at the age of 13, and the owner's like, "Well, I think she's lost weight." Well, how much weight? I don't know.
Right.
2 pounds? Is it a half a pound? What is it? So
Right.
we're like stabbing in the dark when we don't know everything about the history of this pet. We, like you said, we do the teeth, we listen to the heart, so many things you pick up earlier and can actually address. So it's just, you want your cat to live as long as possible. And most of them are very, very healthy throughout their lives because we are blessed that cats generally have a lot. They're maybe less accident prone than dogs. I don't know what it is, but yeah, bring them in once a year. It's just a once a year visit.
Yeah. Yeah. It gives us that really good baseline. Yeah, no, and I've picked up lots of things on cats' annual physical exams. I think the heart murmurs are a big one, where they have an abnormal sound when you're listening to their heart, and it can indicate a variety of different things. Often in kitties, it's a condition known as hypertrophic cardiomyopathy. And it's something that's good to know about because, there are things that we can do if we know that they have the heart murmur. So, we recommend to get an echocardiogram, put them on medication if they need to be put on medication to make their heart beat more efficiently. We're not going to be doing like open heart surgery routinely on these guys. Everybody says, oh, geez, they need to, get surgery. No, it's going to be medical management and ways that we are going to be informing you as the owner of things to look out for if something is going wrong. Even on a physical exam, just a regular general exam, I remember I palpated once. I thought it was a giant mass in the cranial abdomen. It ended up being, I don't know, like 50 hair pieces this cat had eaten at home. And we needed to go in there and do surgery to remove all these hair pieces because the cat was losing weight and the owner didn't even know that. Like the owner didn't know the cat had lost weight. It was just bringing it in for an annual. I thought it might have been this giant stomach mass. And in fact, it just is filled with hair pieces.
Do you mean hair elastics or like toupees?
Yeah. Like hair, like the black hair elastic.
Yeah.
I think it ate like probably like it was more than 50. It must have been.
I had one like that too. That's a weird thing that cats do.
It's so bizarre.
If you during COVID have been doing, hairdressers a lot of the time have been doing their work at home.
Yes.
The cats just sneak over and eat them.
Yeah. It's bizarre. It's bizarre. Yeah. So I do. I think it's a great thing to bring those kitties in. We love seeing them too.
Yeah. This next one is playtime really important? Really an important part of my dog's life, but we'll also say cats because I think this is a good question for cats too. So is playtime really important part of my pet's life? Should they be playing every day for a certain amount of time or with other animals?
Definitely.
Yes.
Yeah.
Yes.
You want to start taking it? And I'll you take it.
Yeah. So here's the thing. We have these animals in our house, right? And they're tame, but they have needs, right? They have needs that are ancestral perhaps, but it all comes back to hunting and all these sort of natural behaviors that they have. And if you don't fill those needs that they have, they will find a way to make your life miserable. So, cats, when you see them going after laser pointer, that's a stalking and hunting behavior, and filling that need will avoid them from maybe eating the hair ties. And dogs are the same thing. We have these play, attention-seeking behaviors that actually turn negative and cause animals to be surrendered because they've destroyed pieces of your house or they're annoying to you. Play fills those needs, and then the dog is more satisfied. And the same thing with some dogs need agility. Some dogs need to fetch, like the border collies. Oh my gosh, play with the border collie.
Yeah.
Right.
Yeah, I think that. And you hit on that point. The breeds, as far as dogs go, first off, dogs, you have breed variation. So there's definitely some breeds that are more driven to performing a job or working. And, those dogs that don't fulfill anything at home or they don't really get that play or any of that stuff, those dogs are definitely going to be at a high risk of having behavioral issues and just mental health issues. Certain breeds are a little bit more lower energy, but even those breeds really still need to engage and be outside and still enjoying playtime. It's the equivalent of if you've been locked up with your kids, kids need to be outside running around playing. I don't know, Krista, if you've kicked your kids out. I've had my kids run around the block. I'm like, just run around the block and then come back and home because you're gone crazy right now. My
kids don't come out of their room anymore because I make them go run around the block.
They've learned. It's learned behavior. Yeah. But though it's so important that, for all of our canine pets to make sure that they really are getting, good exercise every single day, a lot of behavioral issues. And even if you go and see a behavioralist, they're going to say, how much exercise is your dog getting? That is going to be like one of the first things that they're going to be evaluating is how much exercise are they getting? How much engagement are they getting? And just cutting, if you just increase that time, it really cuts back a lot of the behavioral issues. And as far as cats go, I think that we often think that cats are just sort of like lazy creatures and like love sunning, and they do. They sleep more, they enjoy their lives, but they do need to have some enrichment, for them as well. I mean, these are the animals where, a lot of cats that are peeing in the house and that are having some behavioral issues, either with eating different things or just scratching things up. They're not getting that fulfillment. And so we need to, as owners, provide a good enrichment for them too.
And it actually translates to medical issues in cats as well. Actually, dogs with some of the sort of chewing on their paws kinds of things can be boredom. But cats, we were talking about urinary issues in cats.
Yeah.
The young male cat gets urinary issues and gets blocked. And one of the main concerns with that is not specifically just a medical issue. It's that they're bored.
Yeah.
So they're looking for things to do. They're looking for some environmental enrichment. And when they don't get it, they get stressed.
Yeah.
And the stress then causes a medical condition, which is feline lower urinary tract disease.
Yeah.
So that's actually my first prescription for every cat owner that has a cat with this condition is play with them more. And play is it's not like its own separate thing. It's sort of an extension of their normal day. Play for a cat could be putting a box in the kitchen, right?
Yeah.
Like you just put the box there and immediately the cat's in the box.
Right.
So it's like a new environmental stimulus. You think about zoo animals, I hear this all the time, environmental enrichment. If you go to the zoo, you'll see most zoos have started to do all these climbing structures and they throw, a cabbage head in there for the gorillas to like bat around and play with so that they don't do that pacing behavior because they're so stressed. To make their lives better. And the same is true of your cat that is inside your house. Think of your house as the zoo cage and they're bored and let's play with them.
Yeah.
Play.
Yes.
Give your dog a job.
Yes. Totally.
I have one last question on my list here. And I may even be able to help with it. It is, are there any tips you have for helping to train a stubborn dog who doesn't listen well?
Oh, good. Yeah.
Do you have a stubborn dog, Lauren?
I do. You've met Luca.
Yeah.
Well, that's because I've trained him.
He's wonderful. He's not stubborn.
What are you talking about? Poor Luca's getting a bad rap.
Luca is perfect. Let's be honest. But he is part terrier and he's stubborn. He's smart. So he still is, he can be he likes to listen when he wants to. And, he looks right at me and he'll listen to what I have to say and decide to do something else, while glaring at me. So I do understand this question.
I think that often with training and dogs, one of the big mistakes that a lot of people make is they create these training sessions, and a lot of times they're just far too long, or there's so much that they're expecting of their dog during one training session. They really don't have that attention span to last so long, as far as I'm going to train them like multiple different, tricks right now, and we're going to go through all this stuff. They just don't have that mental bandwidth to still stay tuned into you. Certain dogs, again, you talk about various breeds. There are going to be some breeds that are a little bit more attentive, but then you're going to have the need for a lot of these dogs that just need a mental break. They will not want you to keep training them for a long period of time. And so, training a puppy that hasn't really been out yet to exercise and hasn't let loose yet, and then try to make them focus on you, it's not going to work. And, I think now too, it's funny, talking about remote and children and dogs, not that they're the same, but, I look at my first grader and, the first thing in the morning that the teacher has them do is up and they're moving their arms and they're jiggling around and she has them dancing and all this motion before she sits them down and starts teaching them for the day. And so you need to let out that energy as well. And you need to be cognizant that the attention span isn't as long as your attention span will be. It's going to be much, 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 much shorter. So small victories, and then try not to stress your dog out, while you're training.
Yeah, I think, too, some of it is not so much that the dog is stubborn. It can be that the dog is stubborn, but it also can be they haven't found the thing that makes them work for it, right? So like I had a basset hound, they're known for being stubborn, but I still was able to teach him all of his commands and he did them religiously. Why? Because he's a basset hound and he wanted the food, right? So, but not every dog is food motivated. Some are motivated by love. Some are motivated by just the thrill of life, like a lab, maybe.
Yep.
So you do have to, if you think your dog is stubborn, then I would probably redirect and say, okay, maybe they're stubborn, but maybe I just haven't found the thing that motivates them yet. Maybe going for a walk, like all of these dogs that are, especially the police dogs,
Mhm.
some of them are motivated by things like play. Like they don't get to play with a toy until they've done their job for the day, or they
Right.
don't get to, some of them, they only eat, they have to work to eat, right? So
Yep.
they don't get a meal until they've done a little, sniffing session, even if it's a really small session. So that is key for sure, finding the thing that makes your dog over the moon want to work for you. And it's also, sometimes people need a little bit more training themselves about training methods, right? So I've seen a lot of people that said they weren't having success with training, but they were giving their dog really unclear messages and
Right.
not focusing, like they're yelling, sit, 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 but they're not showing the dog what they want them to do. They're just kind of yelling this word, which is in fact a different language. So your dog does not understand a single English word until you teach them those words. I'm
Right.
sure that person with what about bunny could
Bunny,
understand that.
Yeah.
But, so if you're having trouble and you're saying your dog is stubborn, I would suggest going and seeking, a trainer and going for a training session that you participate in, right? You don't send your dog away for training because you need to learn how to do the training as well. And I think those things combined with Lindsay. I don't know, Lauren, did you have any suggestions for Luca?
Well, yeah, I mean, so I did training with Luca when he was a puppy. We went through two training classes. So of course I always suggest that, not only for training him, but I definitely learned a lot in those classes, but it also allowed me to train him with a lot of distraction because there were other dogs in the class. And so so that was really good. That was when he was young. He's 10 now. So and we stuck with clicker training because that's what we got from the program. And the clicker's been great. Even as a 10-year-old, we just learned a new trick. Like if I want to teach him something new, the clicker, and he's so smart, it works so quickly. But another thing I added in when he was about 4 years old, which is, some people think it's controversial because they're all about the positive only reinforcement, but it's a remote collar. And I think they work brilliantly for certain types of dogs. Obviously, the most perfectly behaved and listening dog doesn't necessarily need one, but I also found that it's a great safety net in case of emergency as well. So if there's, some sort of hazard, or if they all of a sudden take off and they're running towards a road, for me, it's good. We like to work on some off leash stuff, and just having the collar on. We actually don't use the electric shock. It's more like a static shock. Like if you were to touch like a metal light switch or something, like that little, like, ooh, it just gets your attention. But we mostly use the vibrate or the sound, and that's all he needs. He's very sensitive. So he's like, okay, I'm listening. But that has worked wonders. So whenever we go out to do kind of playtime, I work in some, every now and then I'll call him back, say heel, and he'll come right back. And, so we work in some of that, but that collar has been a lifesaver.
Yeah. Yeah. I just usually advise that, people who are thinking about that kind of stuff is like, make sure that you have a good relationship with the trainer so they can advise you on it. Cause I've definitely seen them use, I think they're controversial when they're used inappropriately, right? If they're used correctly, then as you say, every behavior is a combination of positive, some negative enforcement in many ways. But I especially like the bark collars that are citronella spray.
Yeah.
My dog does very well with those. But both positive and negative reinforcement have their place in training. But I think both of them, you have to use them correctly or it will backfire. And so, using them with a trainer's help is great.
Yeah, often the problems that our dogs have, it really not the dog. It really is going to be us. So, if you are struggling, like everybody has said, seeking out, appropriate training help and getting it from a good trainer, because all trainers are not created equal. So, making sure you're getting an appropriate trainer too.
what you were saying, Krista, about keeping it, a positive thing as well. It is important to do that and never make it seem like it's a punishment. And when I bring it out, Luca gets excited because he knows we're going out somewhere to go explore. We're going to do a little bit of training, but that's kind of mixed in. And so it's an exciting thing. So keeping it a positive, exciting thing means that it's not going to be this negative reinforcement type of tool.
Yeah.
I actually have something to throw in about that.
Yeah.
I don't know if you guys saw, but it was a big thing maybe last week or the week before that, but Petco actually, they made a big thing about they're not selling. They're going to completely stop selling those training collars. They worded it shock collars, so they're a little unclear on if it's the ones that just buzz and things like that. But I don't know if you guys have an opinion on that and if you guys think that is the right thing. Or...
I mean, I guess I'll give you my opinion overall is that some companies tend to go a little bit more flying by the winds of public opinion than they do based upon truly science or what's in the best interest of all pets. So Petco also made a decision a bunch of months ago to stop carrying any food that had what they deemed artificial, flavoring or additives and stuff. And, some other companies have said, well, we trust vets to advise clients on what their pets are receiving. So, I think a lot of it is I'm not a fan of some company deciding what pets should or shouldn't get. I think that if there's a need for these kinds of things, then there's a need for them, and they're kind of inserting their judgment. So that's kind of you can get the collars if you want them somewhere else. They just have decided not to stock them. I don't know. What do you think, Lindsay?
I think it's tricky. I think that it's one of those controversial items for sure that is a hot topic for a lot of people. It's nice that Lauren kind of brought it up because it is one of those things where the vast majority of behaviorists will say not to use them. And I think that honestly, the reason why they're not using them is because they're probably having owners use them incorrectly, and you're creating more behavior problems than actually making a benefit or making a positive, outcome in your pet. So I do think there's a time and a place for them, but it's got to be done really right, and it's got to be done with the appropriate people that oversee it. And that's the problem, is that often it isn't. And I think that they just try to, like you said, it is a court of public opinion in a lot of ways. A lot of people get backlash, or a lot of companies are getting backlash if they are. And so I think as a general rule, they're just trying to say, we won't. But it is one of those things where you need to look at it on an individual basis. All right. So next week, actually, next month, we actually have a really exciting episode lined up for you. We have a pet insurance company coming on to talk to us about all various things pet insurance related. It's a big one. So we're going to leave it as a little what is the term? Like a little teaser
Yeah.
that, we're not going to tell you which company is going to be coming on, but it's a big one and I'm really excited about it. And it should be something that all pet owners really should sign on for, because, pet insurance really is something that I, try to get all of my puppy and kitty owners to sign up for. It is so important, and it's wonderful when you have it, especially if something, unfortunate happens, to have that insurance is wonderful. So that'll be fun.
There might be something special for Ethos clients when they tune in. They'll learn about.
Oh, all right. That's even another teaser teaser part 2.
So that is on November 11th. I don't know if you meant that's November 11th. We'll be having that episode.
Awesome. Sounds good.
Excellent. So I guess it's time for us to say goodbye. I want to thank again our sponsor, Ethos Veterinary Health. And please go on to your favorite podcasting programs and like us and subscribe to us so that we get more listeners.
Yeah. And from Boulder Veterinary Hospital, I'm Lindsay Renzullo.
I'm Christopher Nolikin.
See you next time.
See you next time.